Our next
Thank you
speaker
so
is
much.
Dr. SHWETA Tripathi, consultant glaucomatologist from Lucknow, who is going to tell us how she managed a difficult situation, a traumatic eye with glaucoma. On to you, Dr. SHWETA. Can you share your video?
Thank you, ma'am. Good evening, all.
SHWETA, it's not coming. It's coming. It's coming
Not
now.
coming, huh?
It's coming.
It's not coming.
It's coming now. Can you please stop and again start? Because something black is coming. Just go to back and start again.
Yeah. Okay. Now is it fine?
Yes, ma'am, it's fine.
Okay. Thank you.
Thank you very much, Dr. Shweta. Wonderful video. I'm going to ask a question from Dr. Ganesh Raman for this. Dr. Ganesh? Dr. Ganesh, can you unmute yourself? Yeah. What are your thoughts about having put interrupted sutures along with releasable? Could she have done without it and just put two releasables or one?
No, that's a good idea because it's a triangular flap, so you want the flow to be directed posteriorly. So Penko's article on fluid flow after trabectomy, there's a very nice article in which they compared a rectangular setup model and a triangular model, in which the triangular model has a better flow. And if you were to release the suture early on, you still have very good control. So that's one big advantage of using a triangular flap, in which you can put a apical suture at the at the apex, and then the triangular being interrupted at the sides. That's a very good technique, actually.
Dr. Sushmita, did we see that? We noticed that she has given one 5FU injection in a week's time. What are your thoughts on that? Would you give it as early as that, or would you follow it up with more injections? What would you say?
The injection of 5FU is completely dependent on the morphology of the bleb. So when I see corkscrew vessels, it might be even maybe 4 or 5 days into surgery. But if I see corkscrew vessels, remember, corkscrewing is a surface sign of underlying fibrosis under the conjunctiva. So once that fibrosis is happening, the vessels which should have been straight start screwing on each other. And when you give the 5FU, actually, if you call them back a week or 10 days later and you photograph them, it's beautifully seen as getting straightened again, which you know that the antifibrosis. So neither the intraocular pressure nor the timing. What matters to me is what the bleb looks like. And sure, if I think at 5 to 7 days, it's looking I wouldn't do it before maybe 5 to 7 days because I've already used MMC. But surely after the first week, I would inject. And depending on how many, actually, we get quite a few. I mean, in some patients, they have up to 3 or 4 injections also, depending on what they have, what they need. So that's what depends.
Thank you very much for that very relevant tip. And I think, paucity of time, I should go on to our next